fourth virtual town hall. I'm Shannon Harden. I have the honor of serving as City Council President. Today, we will hear from Councilmember Mitch Brown, from Councilmember Emmanuel Remy, and from President Pro Tem Elizabeth Brown. We also have our fellow council members, Councilmember Shayla Favor and Councilmember Rob Dorans with us as part of the town hall as well. We'll kick things off with an update from Columbus Public Health Policy Director Edward Johnson. He'll provide us a status update on COVID-19 in Columbus and lay out how Columbus Public Health is responding. We then will hear from Councilmember Remy and the Department of Public Service about litter, illegal dumping, and trash removal during COVID-19. After that, we'll hear about emergency protocols with Safety Chair Mitch Brown and Columbus Fire Division Battalion Chief Steve Martin. Finally, we will talk about financial resiliency and empowerment with President Pro Tem Elizabeth Brown and Columbus Urban League CEO Stephanie Hightower. So we've been collecting resident questions by email and social media. Our council members and special guests will be answering some of those questions as we go through the town hall this afternoon. Once again, this week we have interpreters for American Sign Language from the Deaf Services Center. So thank you all for being here. So at this time, I'd like to welcome Edward Johnson. He's the Director of Policy at Columbus Public Health. Edward, thank you for joining us today. I always start off by saying thank you to your team and to all those folks at Public Health, to Dr. Roberts for keeping our community safe.
Well, thank you very much for that acknowledgement. We're working very hard to protect the health and improve the lives of all of Columbus's residents. So thank you, and I will be certain to pass that along to all of the team here in the building. Just to start off with the update, in terms of the numbers, in terms of cases as of today, Columbus is at 1,609 cases. Of those, 43 are deaths, and 251, or 16%, are hospitalizations. As we've reported in past weeks, the 20 to 29-year-old age group continues to lead the way in terms of diagnosed cases. And so we always ask folks to stay home as possible. I'm certain many of you are aware, based on the mayor's town hall earlier this morning and the governor's press conference this afternoon, we've been working with them kind of hand in glove on how to reopen Ohio, but Columbus specifically for all of us. And we thank everyone from Governor DeWine to Dr. Acton to Mayor Ginther to Dr. Roberts for all of their leadership, because protecting health and improving life continues to be the #1 priority. Because of the hard work of our community in terms of staying home and making those sacrifices, we've been able to prevent widespread transmission of COVID-19 in our community. There's been no run on hospitals, no widespread transmission, and no widespread deaths and fatalities like we've seen in other parts of the country. When all of this began, Dr. Acton said that it would look like an overreaction if we got it right. And I think that we're starting to see some of that play out now. But to be clear, in order to open up our community, Dr. Roberts and Mayor Ginther have been very clear about what they would like to see. They'd like to see more testing and more swab kits, which are on the way. Clear and consistent guidance about how to handle large gatherings and long-term care facilities, which seems to have come down from the governor's office and from the Ohio Department of Health. And then encouraging the widespread use of face coverings. We still continue to urge folks to stay at home when they can, because this is going to be a multi-layered and multi-tactic approach to protecting our health. But we're going to reopen Columbus safely and slowly. And we will continue to do what we're best at here at Columbus Public Health, and that's 3 things. The first is we will continue to conduct contact case tracing, which we've been doing since day 1 of this pandemic and this outbreak. We have our team of disease detectives here at Columbus Public Health who interview every COVID-19 case in our jurisdiction, and we notify and quarantine all close contacts. Second, we will continue community surveillance to identify disease outbreaks and trends. We publish an extensive weekly report every Friday on our website with data including gender, age, race, and zip code to help guide our response. And third, we will continue business inspections to ensure social distancing and hygiene standards are being upheld. To date, we've conducted 495 joint inspections with Columbus Police. We've conducted 112 compliance checks of our own licensed facilities, and we've issued 29 warning letters to ensure that businesses are in compliance with social distancing and hygiene protocols. Our collective response is a marathon. It is not a sprint. We will continue to work with our partners at the state on reopening to ensure that the days ahead are healthy and safe for all of Columbus's residents. And I'm free to answer any questions you might have, Council President or members of council.
Thank you, Mr. Johnson. So today, yesterday, the governor laid out his guidelines for how we transition Ohio out of maybe the shelter in place to this next level of our new normal. You talked about the 5 things that Mayor Ginther asked for in terms of Columbus feeling comfortable in following that lead. One of those things that was asked of the mayor, from the mayor to the governor, and the governor put in the plan for transition, is face mask. I was watching today, Director, and saw that the governor said that kind of had questions around face masks. How can we be as clear as possible here in Columbus around what is our guidance for who should wear face mask, when they should wear a face mask, and what our local advisement is on the usage of face masks?
Absolutely. That's a great question, Council President. And just to be very clear, the mayor, the health commissioner strongly advise that everyone wear a face mask when they need to go out in public. So the first recommendation is to stay at home when you need to stay at home. That is the first guidance. The second guidance is to wear a mask in public if you have to go out. It's a strong recommendation. The mayor will be wearing a mask in public when he needs to. The health commissioner will be wearing a mask in public when she needs to. I will be wearing a mask in public when I need to. And so we recommend that to our residents in the strongest terms, understanding that it is not a requirement, but it is a very strong recommendation.
And as we move forward with the gradual transition, and we talk about testing, how are we growing our capacity locally? It seems like the health department will kind of be lead on the local level for the contact tracing portions of the plan. But how are we talking about testing locally and in our comfort level that we will be able to test enough to keep people safe as we transition?
Absolutely. We know that there is some capacity at our local hospital laboratories to do increased testing. And with the CDC guidance or with CDC recommendations adding 6 symptoms to COVID-19 diagnoses, we feel that that can expand the number of folks who get tested. Additionally, we're working with our FQHCs, our federally qualified health centers, so that they can offer testings in communities in need as well, looking at different models to ensure that folks are well served, and folks that may not be able to access a test right now for any variety of reasons, when they exhibit the symptoms, they'll be able to get it in the most culturally competent and easiest way possible for these folks. So we are looking to ramp that up. Columbus Public Health has received I believe a couple of hundred test kits. We are distributing those to long-term care facilities and others to ensure that testing is more localized and more readily available throughout our community. Thank you.
Well, thank you, Mr. Johnson. Thank you again. Please pass along our sincere appreciation to all the frontline folks that are working at Columbus Public Health. Your folks, they're our folks, they're our neighbors. And they've been working extremely hard on our behalf, and we're very grateful.
Thank you.
So now let us talk about how Columbus is handling trash removal and litter mitigation. We have Council Member Emmanuel Remy, Refuse Administrator Tim Swagger, and Assistant Director Randy Borntrager with us today. Council Member Remy, take it away.
One second. Thank you so much, Council President Harden. I want to start off by thanking all of my council colleagues, our guests, the departmental leadership, and the community for recognizing the importance of these discussions. As chair of the Environmental Environment Committee, I'm honored to lead us in our discussion regarding litter and illegal dumping. Litter and illegal dumping has been a shared concern of both the residents and the city of Columbus. Throughout our community, blight has presented itself, and the issuance of the stay-at-home order has not swayed its prevalence. As the previous past president of the Northland Community Council, I know firsthand how the city has taken and continues to take great responsibility in addressing blight in our community. I also know the level of community support needed to make this work successfully. I would like to call on all of us as individuals who call Columbus home to continue doing our part in creating and maintaining a cleaner Columbus. Actions that we can take as individuals include bagging your household trash prior to placing it in a refuse container. That's incredibly important as our refuse operators dump that trash into the trucks. It's important that it's bagged entirely, otherwise it starts to fly out and cause litter issues within the community. Properly dispose of single-use waste such as pop bottles, chip bags, fast food packaging, cigarette butts, etc. Please do not throw this waste on the ground. Encourage others to properly dispose of waste as well. For those items that you can recycle, place them in your recycling bin. Do not use plastic bags, however. That really wrecks the machines and makes it hard and costs more for us to recycle. It will definitely save space in your refuse container. Properly dispose of your qualifying bulk items by scheduling a bulk pickup by simply calling 614-645-3111 or by going to www.311.columbus.gov. Properly dispose of construction waste by either contacting a private hauler or delivering directly to SWACO, located at 4239 London Groveport Road near Interstate 71 South. For more information, you can go to www.swaco.org. Now I would like to turn it over to Tim Swager, our administrator for the Division of Refuse, to provide an update on refuse collection and illegal dumping. Tim?
Thank you, Councilmember Remy, council members, President Harden. Refuse continues to collect like we always have. We're seeing an uptick in refuse with the stay-at-home orders. The volume of refuse has increased almost 30%. So we're picking up a lot more trash, mainly because people are at home, so they're generating more trash. So it's causing some work on our end. We're having to double up on some of our routes. We're having to send extra trucks out. Fortunate for us, our workers have been coming to work every day. We've been very fortunate with our attendance numbers being very high that we've been able to get out, get all this work done with very minimal disturbances. One thing we do tell the residents, please make sure you're getting your cans out by 6 a.m. because we are getting out faster than ever. We're really hitting this hard. So we are seeing some people that are used to us being there at 8:39. We're getting there at 6:37 now, and you know, they're not getting their cans out on time. So we do encourage them to make sure they're getting out there as quick as they can so that we can get it collected. So refuse, we're seeing more trash, but we're getting it done like we always have. So we're continuing to be successful with that. And unfortunately, on the illegal dumping side, we're seeing illegal dumping continue during this time. We are asking, since we have more people at home, to use their eyes in their neighborhoods to help us fight that battle as well. Because while we're sheltering at, staying at home, unfortunately, illegal dumping is continuing. So we're hoping that we can get the citizens' help, the residents, to watch their neighborhoods and give us any pertinent information to help us in that battle as well.
Thank you. Thank you so much, Tim. I know we've had some conversations going. There's been people that have been asking about, more trash being held at home, because people are at home, there's more trash being generated. Of course, like you just mentioned, we're at our max when it comes to worker output, let's just say. But there are a couple of things that people can do. They could either increase their recycling abilities, and sometimes that requires a second group of, a second container, or they can also purchase another 96-gallon container if there's that much trash within their home, and the refuse drivers will pick up both. Could you talk a little bit about that?
Yes, certainly. So a few things that they can do. Yeah, obviously, we prefer that people recycle more. The more you recycle, the less trash we have. It's better for the environment, better for us, sustainable, really, it's great all around. So the opportunities to recycle and recycle correctly are there. We're seeing a very large increase in cardboard into the waste stream. That's a result of more online shopping, we believe, that's being done since people are staying at home. They're getting stuff delivered, increasing the amount of cardboard that's coming in. And we want to make sure that people understand that that is a recyclable material that really needs to get into the recycling container, because our partners in the recycling, they're actually looking for cardboard right now. The manufacturers out there there's a demand that's not being met right now by the recycling community. We're short on cardboard. We really want people to make sure they get that done. So if people are asking, are we still recycling during this? It's a resounding yes. We definitely are recycling, and we have opportunity to increase that. If the recycling container is not large enough, we do offer that you can purchase a second container, a second recycling container. You can go onto our website, the Columbus Public Services Division of Refuse, and you can get an order form or call 311 and you can get a second container. It's about $48 to order one. That's a one-time cost for the actual unit. And then Rumpke, our vendor, would dump that. On the refuse side, we do allow a second container as well. You can purchase a second refuse container through that same method. And a second container is about $96, $97 to purchase one of those. And we would collect those at the same time we collect your normal one. So you have options out there. We really want to make sure we concentrate on the recycling, reduce, reuse, recycle first.
I know that we have the police app. I just wanted to mention that people can use to actually report littering problems. If they go to any of the Play Store, either with iPhone or Android, and they look up the Columbus Police app, it's a very useful tool to be able to report some of those littering. And then I know that we have Randy Borntrager on as well. And Randy, the Department of Public Service is actually out there collecting litter as well. They're actually assisting the refuse department. Is that correct?
Absolutely. Absolutely, council member. We're actually working across divisions to litter index our entire city in July, which is the first time that will be done citywide. And we're very proud of Tim's effort, as well as Frank Williams, who's the administrator of our Division of Infrastructure Management. We're out there every day. The Division of Infrastructure Management has responsibility to maintain our right-of-way, and that includes delittering over 5,600 lane miles of roadway. A lot of that gets conflated with mowing, because we have to delitter before we can mow. So the safety of our equipment and personnel, and also the waterways and those type of things. But we've already picked up over 60 tons of litter since the beginning of the year. That's compared to 124 tons that we picked up last year. We started our spring intensive delittering on major arterial and high generation areas to beautify and reduce the threat to the waterways and wildlife that litter causes. And we have to make sure that we do this effectively. Global warming has made the last several springs some of the wettest on record, and so we're always learning, starting these in different times, trying to figure out how we can be most effective. But we have over 125 high litter locations throughout the city, and like I said, more than 5,000 lane miles. So this is a major undertaking. I was just at one location yesterday on Refugee Road, and we had a team of 7 getting what they can on one of the few dry days that we've had in Columbus over the last week or two. And then I would like to emphasize that the division's Clean Columbus program continues to delitter after the spring intensive efforts throughout the year. So it's a continual process that the same folks that are your snow warriors that are out there driving the big snow trucks and de-icing and getting the snow off are cross-trained to also do the delittering program and other things within the division. So it's an intense effort, and one that we're tackling every single day.
Well, thank you, and thank you to all the workers in both the Division of Infrastructure and the Refuse Department for putting themselves out there on the front line. I know Council President has some questions for the public. We talked a little bit in some of my community hours last week about the change from 300 to 96 gallon and some of the communities having some questions. So I'll turn it back over to Council President Harden to ask some of those questions.
Thank you, Councilmember. And I just want to echo your comments to Tim and Randy, providing a sincere appreciation to those frontline workers that work in public service who are allowing us. I talk often about, some of us in city government are able to work from home, but I saw you out last week, Councilmember Remy, thanking our refuse workers who have been working extremely hard. Um, over the last several weeks. So we appreciate you guys. We have a question from Weeda Jackson, and she asked, "What has been the response to the new smaller trash receptacles? From what she has seen, they seem to create more trash on the streets. Will the city reassess before rolling out this policy citywide?" And that, Tim, would you be able to answer that question?
Yes, Council President, that's a great question. We continually monitor and review and always track what we're doing here. We see that 300 to 90 gallon containers historically have been a good transition that has reduced trash throughout the city. There are neighborhoods and areas that they don't always work. And in those areas, that's what we continue to look at. Historically speaking, as we've done this the last 3 years, the data shows that when we go from a 300 in an alley to 90 gallon front collection, that tends to be the most successful reduction, because we don't have a 300 gallon container that sits in the alley that is always there and open to illegal dumping, so anyone driving down can throw in trash or throw it next to the trash can. When we go to move them to the front with a 90 gallon, the homeowners therefore push them in and out like we have in 95% of the city. The homeowners push them in out to the front, we collect, they pull them back in, so it doesn't leave the opportunity for illegal dumping as often as the 300s do. And then also with the 90s going in and out, there tends to be less debris dropped in the front. People are more willing to illegally dump in alleys than they are in the front of the house. So what we typically see is that the 90 gallon front collection is the cleanest that we have. That being said, it's not always possible to do throughout the city, so we continue to monitor and revise it as necessary.
Thank you, Tim. A follow-up question to that someone, Marion Lupo, was asking if the 300 gallon containers pose a health risk in any way. She also asked what factors or process go into determining if you receive a 90 versus 300 that you might have kind of seen.
Yeah, so as far as 300s being less healthy than the 90, there's no data or no information that shows that they're less healthy than any type of container. If you bag your trash, put them into the container, we collect them. It doesn't matter what we collected in, be it a compactor, a dumpster, a 300, a 90. We collect throughout the city in a variety of ways, and it really comes down to the homeowners bagging their trash and putting it into the container properly. That's the healthiest way to address those. As far as switching over 300 to 90s, what determines what we do, how we do that is on-street parking. Obviously, if you have a lot of on-street parking and we can't go down and collect them because the residents have no place to park other than in front of their street, that's a great prohibitive measure for us, because we have to be able to have 3 feet on each side of the container to safely collect it with our automated collection. Also, we look at the front of the houses. Are there ways for the residents to get the 90s down there? If you have a bunch of houses up on hills that residents can't safely push a 90 down to the front of their house, then we tend to stick with alley collection on those as well. So we look at a variety of things, what type of method of collection we can put in that neighborhood. But the goal is to switch out as many 300s to 90s as we can, but we realize that it's not always going to be possible. Up to this point, we've switched out it's over 5,000 households have been switched from 300 to 90 gallon containers. And we have another 4,000 scheduled to go yet this year. So we're switching over a large portion of the city, and we will continue to monitor those. But we have a schedule for each of the next 7 months here, where we'll continue to convert those 300s to 90s wherever possible. Once we're completed with this round of it, then we'll go back to those harder to reach areas that maybe the solution isn't quite as simple as switching to a 90 front service, and we'll start addressing some of those individually.
Well, thank you so much to Randy and Tim for the work that you're doing. Please again pass along our appreciation to Councilmember Remy. Thank you for your leadership of this important committee and keeping folks informed over the last several weeks. We've all really appreciated um, your one-off town halls that you've been doing with a lot of the folks that have that we've talked to. So just thank you. Now we've got Councilmember Mitch Brown and Battalion Chief Steve Martin. But first, I want to put in a quick plug for our census. An accurate census count informs how hundreds of billions of dollars will be distributed for critical services like health clinics, schools, public transit, and tons of other programs. It takes 5 or 10 minutes to complete, and it's so important. So please, please, please visit 2020census.gov to ensure Ohio gets our fair share. Again, that's 2020census.gov. Now I would like to introduce Councilmember Mitchell J. Brown and Columbus Fire Department Battalion Chief Steve Martin. Councilmember Brown, or is it Station 3 we call you, Councilmember? Take it away.
Thank you, Council President, President Pro Tem, and my colleagues, and for all of our guests. Over the past few weeks, I found myself reflecting on the words of Robert Frost. The only way out is through, which is from a poem by Servant to Servants. These words encapsulate an effort and sacrifice required to successfully navigate this crisis. As Ohio begins to reopen with the threat of the virus continuing to threaten our residents, it is important to reiterate that we will get through this together. While this challenge is different from any other in our lifetime, I am reminded of our community's response during another recent crisis, the recession of 2008. I've seen this community devastated by hardship and loss, and I've also seen us rebuild together. I continue to be amazed by Columbus's fortitude as we face adversity. While this crisis continues to challenge us, our spirit of collaboration has remained strong, and patrons continue to support business owners as fundraising campaigns are met with generous contributions, as first responders receive messages of support, and as our most vulnerable are recognized and cared for, we get one step closer to our way out. We have proven that Columbus stands for the collective values of caring for one another, compassion for one another, and commitment to each other. We can overcome this challenge like we have before together. Today, I'd like to highlight the work of our Columbus Division of Fire. As we navigate our way through this crisis, our fire and EMS personnel have been busy ensuring that Columbus residents continue to receive excellent pre-hospital emergency care as our community combats the impacts of COVID-19. I'd like to focus on the precautions taken by our first responders to ensure their safety and the safety of the residents they serve. We will discuss the appropriate circumstances of when to call 911 to reassure our residents that Columbus Division of Fire is prepared and ready to respond in the event of an emergency. And with that, I'd like to invite Battalion Chief Steve Martin from the Columbus Division of Fire to share some opening remarks. Chief Martin.
Thank you, Councilmember Brown, President Harden, Council Pro Tem, and the rest of council members. I'm very honored to represent the Division of Fire today and answer some questions.
With that, Council President, I understand that you have some questions you'd like to have us address.
Thank you so much, council member, and to Chief Martin. We do have a couple questions. One of the questions that we received over the last couple of days was, what symptoms should residents pay attention to if they suspect they may have contracted COVID-19? And more specifically, when should they make the call to 911?
That's an excellent question, sir. Nationally, we're seeing where people are reevaluating when to call 911, and there's a fear that they're not calling when they should be. So I'd like to go over a little bit of what they can expect. The CDC, as information continues to come in, they're now saying that people can be COVID-19 positive with no symptoms to mild symptoms to severe illness. And the COVID part of it is kind of like a flu. There's no cure. So it doesn't necessarily mean it's an automatic ride to the hospital. But what we want people to watch for is if you're experiencing a fever, cough, shortness of breath, or difficulty breathing, chills, shaking muscles, sore throat, headache. And now one thing that's new is a loss of taste or smell. If you're experiencing any of these things, call your personal physician and talk to them. If you don't have a personal physician, call your insurance provider because they can give you a list of physicians that are in the network. And if you don't have uh, insurance, then we would ask you to call Columbus Public Health at 614-645-1519 or look them up on your smartphone. They can have answers. Now, if any of these symptoms get to the point where you're having trouble breathing, and trouble is not necessarily, I just went up 2 flights of steps and I'm out of breath. Trouble's when you're sitting in your chair and you're out of breath, or you have persistent pain or pressure in your chest, or confusion or inability to stay awake, or you start having bluish lips or very pale, then it's time to call 911. And then the other thing is, any other time that you would call 911 for an emergency, we want you to do so. When in doubt, give us a call. We're not trying to avoid these runs, but at the same time, our goal was to educate the public so we wouldn't overwhelm the hospitals. So I hope that kind of clears some up.
Thank you, Chief. That was very helpful, and I'm assuming that we were fearful that folks who were critically ill or because of the fear of COVID and COVID being in the hospitals weren't calling us, and so we're trying to reverse that message, right, and make sure that folks are reaching out when they need us.
Exactly. Yeah, we can't do much for you if it's a common cold. Um, but yeah, now we're just afraid the people that need us are not calling us, and we'd prefer to go the other way and have people call us when in doubt.
Certainly, certainly. So we have another question. So while much of our community has stayed at home to prevent contracting COVID-19, how has the Division of Fire protected our EMS personnel and residents as they continue to provide pre-hospital care on the way to the hospital?
So we're doing a number of things. The first thing is when we come to work in the morning, uh, our emergency services personnel, as well as our 40-hour personnel, we all go through a quick screening. We're asked a number of questions. Have we been exposed to anybody that's had COVID type symptoms or anybody that's ill? How are we feeling? And then we get our temperature taken. And if the answers are good and the temperature is good, then we go to work. That temperature and screening is on our emergency service people that work 24 hours at a time. They do that again after dinner before 8 o'clock at night. So we're trying to make sure that our people are healthy while they're on duty. We're trying to limit our exposure to outside sources that may be infected. And so we've closed down fire stations to people visiting other than the on-duty personnel. Even if I work at a particular station, I can't go in there if it's not my duty day because they don't want me bringing a bug into the firehouse. And so that keeps our people isolated. When we do go out with others, we're wearing PPE appropriate for the situation. If we're going to a grocery store to get our daily groceries, that might be surgical masks that we're all wearing. But then when we approach a patient that needs medical care, our people would have a stronger mask. We call it a P100 mask. It's a filtered, reusable, durable mask. And then we wear eye protection, gloves, and some kind of barrier, either a gown or like a raincoat that protects us. And then to protect others as well as ourselves, if we would transport somebody that's ill to the hospital, there is a defined couple layers of decontamination and cleaning of the vehicle, as well as getting our PPE off and cleaned or disposed of properly so that we're not spreading any possible contaminants from a previous patient. And then we just keep reemphasizing to everybody, don't touch your face, wash your hands often. We also clean the station. Before we go off duty, we wake up at 6:30 in the morning, we clean the station, And then at 8:30 in the morning, after the new shift is on, they're cleaning the station. Then they do it again after dinner. So that station's been all solid surfaces and flat surfaces are clean. And then we're trying not to move around the station too much and spread anything.
Thank you, Chief. So again, we were talking earlier to Director Johnson about the governor's recommendations yesterday to reopen business. One of the guidelines the governor spoke about is the reduction of capacity or limiting the capacity of folks in a specific area as determined by the fire code. Can you explain to the residents about the fire code and where patrons can find that information?
Sure. So in places of public gathering like movie theaters, restaurants, bars, places, that kind of thing, there'll be a posted sign that's up on the wall that'll have a maximum capacity. Sometimes there'll be multiples. The church will, you might have a church hall that says maximum capacity for tabled seating as opposed to an auditorium style seating. But there's a lot of places that will not have that posted. And so what we're asking is uh, shop owners, whether it be beauty parlors or other places, small places of business like a deli, they're not going to have that occupancy sign up. But we're asking for the business owners to understand how many people they would normally have in there and then work at reducing that. I've been in some retail places now that have taped X's on the floor where people can stand while they wait for food to be delivered or something, which helps control that occupancy. And then if you're a patron and you're interested, you'd have to reach out to the business owner because we're not going to have everything like that on file. But as the business owner, uh, we welcome them to give us a call on the fire department and our prevention bureau. And we have ways of determining square footage of retail space versus storage space and how many exits and that kind of thing. And we can determine how many people should be in there.
Thank you, Chief. So the division has several different specialty units, one being the opiate react and the other being like permitting and others. Can you explain, are those specialty units, are they still continuing their work right now?
Absolutely. While we're trying to prevent people from getting sick and helping them if they do, we don't want to drop the ball on the rest of the programs that we have going. Our React team, as you're I'm sure, well aware, uh, are people that are suffering from addiction issues are really hit hard with physical distancing or social distancing. Um, Isolation is one of the enemies of addiction. And so our people are very active in reaching out to people that are in the rehab process to make sure that they know that we're still here, to find out what we can do for them, to keep them engaged, on their path of recovery. And then at the same time, one of our missions is to reach out to the people that have recently experienced an overdose event. And we used to go out and talk to them, maybe in their family room, face to face, sit in their family room on a couch with them. We don't do that any longer. We will go out and leave information in their mailbox that they can read on their own. If they would like to talk to us, we're very happy to talk to them, but we'll do it in their front yard, maintaining physical distancing. And then if there's an opportunity for us to take them to a recovery facility, we're happy to do that. We will drive them to that facility while we're wearing our PPE, and they'll be wearing a mask as well. And then once they're in there, we have a procedure to decontaminate the React vehicles so that we can go back to business. But we don't want to drop the ball on such a great program that I think we're making good strides in. Another part of that is our Narcan education outreach program. Even last week, we don't want to have a big event where we're drawing people to us, but we'll have pop-up events where we might go to a grocery store. There's already going to be people there. We'll go to some of the zip code areas that are have a lot of overdose incidents, and we'll set up a tent and provide education and give out Narcan. And last week, I believe we gave out 150 Narcan kits to people that needed them.
Wow. So the final question is, recently, the city opened fire station number 35. It was in the middle, I think, of the COVID crisis, so we didn't get the usual opportunity to really do the big fanfare. But can you talk about this new fire station that we brought online and who we're serving in the new capacity?
So we call it the Far East Fire Station. It's out on Wagoner Road, just north of Broad a little ways. Um, that area over there was kind of in a kind of an island of no service. So the quickest response times we were measuring at a little over 9 minutes, sometimes 9.7 minutes was our average, which we wanted to do better. And, but a lot of things have to come together, including the need. If you just have one run a week out there, it doesn't justify the station. So the need's there. We built it. The neighbors are glad to have it, glad to have us. I know we looked, we opened March 28th. From January 1st to March 28th, we took 363 runs. So in about 3 months. So, and we were averaging 9.7 minutes per run to arrive on the scene. In the last 30 days now, we've had 102 runs, and we have brought that down to a 7.0 response time. So that's saving 3 minutes. We kind of have a couple things we think about, but one of them is every 2 minutes a fire doubles in size. And so those 3 minutes sometimes could be the difference between an apartment being on fire or an apartment building being on fire. So we're very happy to be out there and look forward to serving those folks out there.
Thank you, Chief. And would you please pass along our appreciation to all the men and women of the Division of Fire? We really appreciate our frontline work, folks who have kept us safe and put themselves in harm's way. So would you please pass along our appreciation?
I sure will. Thank you very much. Pleasure being here.
Thank you, Councilmember Brown, for your leadership as well. And see you on Monday. Our final
Absolutely.
segment this evening is about financial empowerment. Before hearing from our President Pro Tem, Elizabeth Brown, and our Urban League President, Stephanie Hightower, I want to plug another way we can empower local business owners. So last Thursday, Council, along with the Columbus Urban League, the African American Chamber, and a number of other local organizations, launched Buy Black Thursdays. We're encouraging folks in Columbus to support local Black-owned businesses each Thursday during the COVID crisis. We all know that small businesses are hurting during this time, especially minority-owned businesses. So that's why on Thursdays, we'll be sharing a list of Black-owned businesses for folks to support and encouraging people to post a picture tagging the Black-owned business that they have supported. This is just a fun, easy way that we can come together, rally together to support every segment of our community. And again, lean into the concept that we are all in this together. And so we thank everybody who has participated last week. So now let us move on to financial empowerment with President Pro Tem Elizabeth Brown and Columbus Urban League President Stephanie Hightower. Council member, how are you doing this afternoon?
I am doing well. How are you? Can everyone hear me? Okay, cool. I always like to check. So thank you, President Hardin. I would like to thank Ms. Hightower for joining us this afternoon for this important conversation. Before the COVID-19 crisis disrupted the lives and income of workers in Columbus, we knew that many families were already in need of additional protections and support. I'd like to emphasize that what a majority of us are now enduring, lack of childcare, fear for safety, limited access to food, and navigating complicated government assistance programs, these are daily vulnerabilities long experienced by millions of workers in the US, particularly women, and particularly African American and Latina women. At the foundation of these challenges is economic security and financial empowerment for families. According to the Urban Institute, 57% of Columbus families are financially insecure, which means they have less than $2,000 in savings, which is an established amount to help prevent a tragedy or an issue coming up in life that would wipe out all of your savings. 42% of residents have subprime credit scores in Columbus. Last year, I partnered with the Columbus Women's Commission and the mayor's office to apply for and receive a grant from the Cities for Financial Empowerment Fund. The funding is being used to create a financial roadmap for women and families based on the needs of residents and our potential partnership opportunities that we can then explore and leverage and hopefully make permanent. The goal is to build on the services currently available from partners, especially like Columbus Urban League, to strengthen credit scores, improve access to credit and banking services, and to provide household budgeting assistance. Providing women with the resources they need to improve their financial security not only helps them support themselves and their families, but it helps our entire economy and our entire community. That's why this work is more important than ever and why we wanted to bring it to the conversation about recovery from the coronavirus pandemic. One of my biggest concerns is the disproportionate impact this crisis is going to have on the individuals and families who can least afford to weather economic shocks, those who are already in need before these disruptions. The Columbus Urban League has been a leader in all of these efforts. When we talk about building on the services currently available, we are talking about the work that the Urban League is doing right now. And that's why I'm grateful to introduce the Columbus Urban League President and CEO, Stephanie Hightower, to talk more about their financial education and empowerment work and programs. Our hope is that this information is actionable for folks who are listening or someone you might know who needs to access services, because we have good services happening now. Ms. Hightower, the microphone is yours.
Okay, they unmuted me, and I'm sorry that I was not. I've been on for a minute. I'm sorry. You probably saw my name but didn't see my face. Council President Harden, it's been a long 5 weeks, as you know. President Pro Tem Brown, Council Members Remy, Dorans, Favor, and Tyson, thank you for the opportunity to share today. I think Council Member Brown, you've basically said it all. When you talk about the women and families that are going to be disproportionately impacted by COVID-19, we are already seeing the challenges that lie ahead. And I appreciate the fact that you are already talking about recovery and how that will impact the economic power of our community, not only now, but probably for the next, I believe, 18 to 24 months. I think just to put into some context what I'm talking about here and why what we're talking about as far as financial literacy is important is we started, and I was speaking to Council Member Favors earlier today, we started a program for housing stabilization last week, or we announced it again on Monday. We opened the portals. Yesterday, we received 100 calls an hour. Right now, we have about 3,000 people that are on, and we have the data to, and I'm not making this up, I can show every one of you the list. About 3,000, over 3,000 calls have come in. We have right now about 600 people in the queue for these funds, and we know that they're probably going to run out very fast. A lot of these people are women. We know that they are people of color. And so one of the pieces that we are stipulating, if in fact you receive these funds to stabilize your housing, meaning pay rent, utilities, if it's a mortgage payment, we are expecting that you will have to go through one of our financial literacy programs, because we know, as you mentioned, Council Member Brown, this is about credit repair. This is about making sure that folks go to payday lenders in order to, to use them as a financial institutions. It's about getting our folks in the community who will be impacted by this pandemic, how do we get them to become bankable individuals? How do we help them to look at budgeting? How do we look at making sure that if something were to happen again 10 years from now, that there is a savings? Because we know that people of color are disproportionately don't have savings accounts. They don't have mortgages. They don't have the ability to be able to be financially set during these times. So that's one of the requirements, is that we're saying to people, if you are part of this home stabilization program, and we do put some financial resources into your pocket, and by the way, these resources are not going directly to those families. We will pay the utility companies. We will pay the landlords. We will make sure that that is directly applied to whatever the issues are. They have to come through the programs that Councilmember Brown talked about, because at the end of the day, this is about recovery. This is about make sure we can stabilize people. And so what we don't want to look at this is short-term fix, but how can we stabilize those families in the long term? And we know that financial literacy, getting your credit score up to at least 700, will give you the economic stability that you need in order to be a contributing member of our community. I'll pause there because I know there might be a lot of questions.
Thank you.
I can go on and on if you want.
We were mesmerized by the information. I didn't know if Council President Pro Tem wanted to hop in with anything to follow up, or should I jump into questions?
You can jump right into questions, President Harden.
Thank you, President Pro Tem. Actually, I'm gonna start with you, Councilmember. What made you focus on this subject around financial empowerment for this week, and how do you see it playing out as we think through the effects of COVID on our communities, especially of communities that are challenged?
Yeah, absolutely. Well, I think because folks are who are already at risk are going to have a tougher road ahead. That's one of the reasons that we wanted to highlight it. And I think, again, particularly about women, and especially women of color, they're disproportionately impacted when it comes to financial insecurity. Nearly 2/3 of minimum wage workers in the US are women. And that means a couple things. Right now, women make up a disproportionate number of essential workers, because in this crisis, essential workers are a lot of lower wage workers like grocery clerks, delivery drivers. But unfortunately, a lot of women were first in line for layoffs as well, because service sector industry jobs have been so deeply impacted by the crisis. And uninsurance claims show that women, and especially African American women and Latino women, are really bearing the brunt when they didn't have the sort of financial foundation to bear that brunt of the crisis. And I also want to note, this is just a compounding effect. 41% of mothers are the sole or primary breadwinners for their families, earning at least half of their total household income. And an additional 23% of mothers earn at least 25% of their household earnings. So when we think about the necessity of stabilizing women and its effect on families, I just think it is one of our highest callings in this recovery effort. And what I'm thinking a lot about in my own, the coronavirus has been a long experience for my family with 2 small kids and navigating this, this time without childcare. You hear my 2-year-old yelling, come here, probably. One moment, baby, okay? But my situation, it is a privilege to work from home, right? And baby, I'm on my meeting. Give me 1 second and then I'll watch. It is a privilege to be able to work from home and have an income. And when you think about the choices that many parents are going to face, which are impossible as this economy opens up and schools are still not safe enough to open. So I think there's great urgency. And that was a too long answer to the question, but that is why we brought it to the table today.
No, it's critically important, and it's amazing to watch you juggle both working at home at the same time, and so we appreciate you. Stephanie, We got a question. Just could you give us like where can folks get the financial counseling? We know you have the 700 credit score program, but how can folks access these programs? What's the best way for them?
Look, I knew you were going to ask me. Can you that number? Can you get that for me, Tina? The number for the call-in number. So if I could, while she's finding the number, I just want to sort of underscore and reiterate what Councilmember Brown was talking about. There was a New York Times article that came out last week, and it said that 1 in 3 jobs held by women have been designated as essential, according to a Times analysis of census data. Non-white women are more likely to have essential jobs such as cashier, emergency room nurse, home health aide, and more than any other ethnic group. And to also just to give us some context for that, I've had an opportunity to speak with some of the leaders from the Somali community. The majority of those women that are urged are earning wages, they are daycare operators right now. They are small businesses. Their businesses are closed, and so there is no income coming into their households. And so one of the things that I have been asked by the Somali community is basically how can we access resources because a lot of them were not comfortable with going after the PPP dollars. And so these small businesses have come to a halt, and there is no income stream coming into of those homes. So I know that, our immigrant population is also very important to this community, but I just wanted to put that in your ear that, that's one of those communities and areas, especially that is being negatively impacted, especially because women are the ones who are running these daycares. And so what we have now for those individuals who are interested in the home stabilization program, you can call the Columbus Urban League's primary number 614-257-6300, and they will direct you to the numbers that we have for you to call in to the for the home stabilization program. You can also go on our website, but that number now, I have it to directly go into the portal, is 614-484-9111. Again, that number, 614-484-9111. And that will put you into that home stabilization program. If you're interested just in credit repair or just financial literacy, we do hope that sometime next month, we're going to start virtual classes. And again, you can call the main number at 614-257-6300, or you can go online and sign up for those courses. And when we start those, hopefully virtually by mid next month, it's really coming up next month, then you will be in the queue to be a part of those classes.
Thank you, President Hightower. This is the final question. So a lot of us are getting our stimulus checks, or folks have received their stimulus checks. Do you have any recommendations for the minimum amount that folks should try to set aside for savings as folks try to deal with becoming more financially stable, but also pay down their bills?
At this point, President Harden, that's really a hard call for people, because if you haven't had a paycheck in 2 or 3 weeks, you're more than likely you're going to use those dollars, to be able to pay those bills, or you're going to need to pay your mortgage. So, what we're really encouraging people right now to do is pay those bills now. And once we get you back on the right path, whether it be we help find you a new job, or you come off of furlough, or the economy is opened up, that we put you in our classes, our financial literacy classes, and we can begin that process. But we're really encouraging people, if you have to pay your rent, because we think it's important that we keep people in their homes. We do not want to flood the homeless shelters with additional people. And so, I think if the other part that I think people didn't realize, and we found out the other day, that, if in fact you have an arrearage from child support, the stimulus check is going straight into child support. They are intercepting it. And so you have a lot of people there who won't be getting those stimulus checks. So it's a very complicated situation. We know that, but we want to encourage people, at least pay your rent, because we want you to keep a roof over your head, and then we'll help you through the process to come up with a savings down the road.
This was great information. Thank you to President Hightower and to President Pro Tem Brown for this topic. I know that we had a lot of folks engaging and listening, and we appreciate all of these services. So thanks to all the folks who participated in today's town hall. I like to end our town halls by going around the screen, I guess we would say, to council members to see if they have any closing thoughts. And I will start with Councilmember Favor. Councilmember Favor, you have any closing thoughts for us this evening?
Good afternoon, everyone. I just want to extend my appreciation to my colleagues, as well as our special guests who joined us this evening, and would absolutely underscore the work of President Pro Tem Brown and the work of President Hightower, just as it relates to financial literacy and ensuring that our most vulnerable folks are protected during this crisis. So thank you for the work that each and every one of you are doing. Please continue to stay safe during this time. Have a wonderful evening.
Thank you, Councilmember. We'll go to Councilmember Dorns.
Thanks, Council President. Again, thanks for everyone joining tonight. One thing I wanted to mention, I've been trying to push out as much information in the community as possible about navigating the unemployment compensation system. And one of the good things to report is that Ohio is now accepting pre-registration for the expanded unemployment program for those who were not eligible under current Ohio law. So if folks did not make enough money on the weekly average in order to qualify for benefits, or if they're an independent contractor or a gig worker and were not able to access benefits, the state of Ohio is now providing an additional program that's funded through the federal government. So this is the $600 per week that folks have heard about. And I wanted to let folks know that they can now apply or pre-register for that program at unemploymenthealth.ohio.gov/expanded eligibility. And I will have a link to that on my Facebook page as well, just to make sure that folks who maybe were denied originally, they should be eligible for this expanded program and should get that application in sooner than later to make sure that $600 per week benefit flows to them to provide the basic necessities that families need during this crisis. So just want to remind folks that program is rolling out right now. Thanks, Council President.
Thank you, Councilmember Dorns. How about Councilmember Mitch Brown?
Again, thank you, Council President. Just a couple of things that's really important to remind folks. Please stay home unless you have to go out. Maintain appropriate distancing. Wash your hands whenever possible. And please wear a mask when out in public, and do not, under any circumstances, ingest any type of disinfectant. With that, all the best to all my colleagues.
That was very sound health advice, Councilmember, and that's one elected that I would follow and listen to. Thank you, Councilmember. Councilmember Remy.
Yeah, Councilmember Brown, it's like an ongoing Saturday Night Live skit every day. So that's sound advice, very sound advice. Thank you so much, Council President Hardin. You've been doing a great job as moderator. We appreciate it, like the new do, by the way. Thanks to all my council colleagues, everyone that's been helping to make sure that the city is running smoothly under the circumstances. I know we're all working hard. Chief Martin, Randy, Tim, President Hightower, we're all working very hard to make sure that life continues as close to normal as possible. Obviously, this is a little hiccup, but it is just a little hiccup we will certainly bounce back, and we will make things even better than they were before. It's just a matter of doing the right things, as Councilmember Brown mentioned, and making sure that we have flattened the curves before we move forward. So thank you so much again, and look forward to our next one.
That's awesome. And we'll close it out with our President Pro Tem.
Only want to add my thanks, and also my thanks to our workers who have been on the front lines, our city employees who have been on the front lines. They are represented here by our public service department and our public safety department. So much of your workforce is truly out there putting themselves on the line, and they have all of our thanks.
Hey, Russell. All right. Well, thank you, guys. I just want to remind everyone that you can find a huge list of resources at columbus.gov/COVID-19 resources. We will not be holding a town hall next week because we will be meeting to pass legislation as a council. It will be a virtual meeting at our regular time, Monday at 5 p.m. I want to encourage folks to engage with our council meetings. We have worked really hard to make sure that those meetings are accessible, which means that you can find legislation, you can speak on legislation, you can engage, but we encourage you still not to come in person, as we still want to follow the guidelines from the governor. We will be back, however, on Tuesday, May 12th, for a new set of topics. Thank you, everyone, and have a great evening.